I think it would be nice to start with introduction because you and Ruth have not met as yet. And there are only two of you candidates who did this particular batch. So can you just introduce yourself so that Ruth gets to know who you are? Your name, what you do, where you work, etc., etc. And then you tell us a little bit. Well, before we get to your experience with the course, let's start with the introductions first.
All right. Good morning, everyone. Good morning to Ruth. I'm Lusanda Q. I work for a company called Unicore Holdings. My job title is a clinical technician engineer. So my role is to check the spec. When it comes to the actual job title of a clinical engineer, I only check and test machines before we deliver them to their respective places. So, and then the other thing, what I do is to make sure that the specification from the customer are being met by the OEM, your original equipment manufacturer. And then I also check the ISO certificates, the validity, the CE certificate validity. And then the second role that I do is to do presentations about devices that have been shortlisted on a tender. So I go in and then I present and make a case that whatever we have submitted on the tender actually exists on the actual unit. And then the last responsibility is to source and scope for new OEMs in the medical space, whereby we use an online search to check whichever device we are looking for. And then we start to engage with the OEMs that are likely to meet the spec. So in a nutshell, I have three responsibilities. I haven't performed much of maintenance and servicing of devices, but what I usually do is to attend online training sessions whereby the OEMs train or teach me on the basic operations about those particular devices. We are working with a lot of devices from dental devices, oncology, linear accelerators, your general medical devices, which are your defibrillators, your POCT, measuring meters. So there's quite a lot of medical devices that we are working with. But we have been exercised or we have been explored the option of maintenance and servicing. We only buy and then sell it to the customer, which is the public sector for now. Thank you.
Thank you very much for your long introduction. At least with that, we'll get to know exactly who has been doing the course. Yes. Unfortunately, the other candidate has told us he will not be available because he's working. His name is Vuyisile Isaac Makokoza.
Yeah. Yes.
So he'll catch up with the recording later on when he's off duty. So let me allow Ruth to introduce herself. I had told you that I'm not inviting anybody else, yes. But I thought, okay, let me invite the managing director of TUTCE, or formerly TICE.
Yes.
But she was in a meeting. She's in the meeting this morning and says she might join us if they finish on time.
Yes.
But she has asked Ruth to represent TUTCE, which is TUT Continuing Education, formerly TICE.
Yes.
So Ruth, if you can please introduce yourself.
Okay. Sure, Luyanda. Is it Yolanda or Lusanda? How you are doing a lot. You are doing more than three. Lusanda. How you are doing more than 3 roles. What you've just explained. It seems like you have the whole organization in your hands, and I'm very proud of you.
Thank you very much.
Sure. I know you are doing a lot, and I can also already feel how much this course has also, aligned with your growth and the skill that you're going to overlay to the people that are around you.
Yes, that's correct. That's correct. That's correct.
And a promotion coming your way.
I'm not sure about that. I'm not sure about that.
Yes,
But
it's
yeah,
coming.
I wanted to do this course so that I can consolidate my qualifications and then my
Mm,
experience when it comes to the medical devices. So basically, I had to do it.
yeah, and you did it for a very good reason. You will
You
see.
know, Ruth, you are right. There are actually many candidates who have gotten promotion on the basis of
Mm,
just doing this course.
mm.
Yes,
Yeah.
yes.
Yeah, no, it's absolutely worth it. So I'm so glad that we get to meet today. I know we've always engaged on email. I was always telling you, Ish, I'm trying to gather the number so that the course can run. But thank you for still staying patient with us and understanding our situation and still believing in us and still agreeing to say, you know what, guys, okay, fine, this is the situation, but I will still avail myself for this course because I need it as well. So I just
Yes.
want to thank you on that note.
No problem, no problem.
Yeah, and okay, Mr. Tim has introduced me, but okay, well, I'm Ruth Nair, responsible for short learning programs for TUTCE, which was previously TICE. So, yeah, as you've gained this knowledge, I also look forward to you referring us to other people that you'll be sharing the knowledge with and your experience with regards to this course.
Yeah.
Please, yeah. Okay,
Yes, yes,
thank you so
yes.
much.
Yeah,
It
thank
was
you so
nice
much.
meeting you.
You
Thank you.
too, you too.
Thanks.
Yeah. So thank you, Ruth. I was expecting more, but it's okay. Yeah. Tell me, you have completed this course. How has the course been for you? What was most helpful for you? And was the course really relevant, or is it just knowledge you already know, And how do you think you can use this course going forward? Let's hear from you, maybe in the next 3 to 5 minutes.
All right. All right. Thank you, Mr. Tim. I will say when it comes to this course, since I've been in a hospital setting and then I've been mentored by a clinical engineer or clinical technician engineer. So basically, there are three takes from me. I've taken three things from this course when it comes to calibration, to making sure or quality assurance of the medical devices. Uh, first it was the analyzers. The analyzers, I was never exposed to the analyzers. I will be fair on that. And then the second one is the simulations. The simulators, I was never exposed to the simulators of the medical devices. So what was familiar or I once saw or once experienced or once worked with was the electrical circuit
Just to
testing.
analyze
Yes, so it was only that. So and then the other measuring instruments, your multimeter and how to use your multimeter. I was aware of that. But since on that hospital setting, all of the maintenance and the calibration were done by outside party or maybe the owners of those medical equipments when they are still under warranty and guarantee and whatsoever. So all of those things were done by the external service technicians. So that's my first take, whereby now I can be able to calibrate. I can be able to check whether this device after maintenance can be used to diagnose or to treat patients. So that's my first take when it comes to this course. Now I get to know and to have an idea of the other analyzers or the other simulators that are within the medical space, your Fluke. There's a lot. So, and then the other thing when it comes to this course, it was the inventory. They usually call it CAPEX. They were calling it CAPEX. And then I had no idea of what was happening because when on my previous role as a intern, we were only exposed to maintenance and to observe what is done and what to change. All of those small units that you change when it comes to my maintenance and servicing. So, and then that's my second take, whereby the administration side of clinical engineering technician or engineer, what is about. And then the third one was to try and communicate with others, because we're doing a lot of communication with Voicele. I have to state that we're doing a lot of communication, even for the tasks that we had some problem with, because you can imagine that some of the other concept when it comes to the medical terminology in engineering, we're quite new to Voicele and to myself. So the course, and then the other thing about the course was the feedback we will have or would receive from you, which was anytime that we had a question, but we didn't ask a lot of questions, or I didn't ask a lot of questions, because some of the things were done as self-study, and then I was able to comprehend. So, and then for me, the course was very, very helpful, having to know the sources, because the problem is you go to Google, you go to YouTube, and then you don't know the sources. Now that on that content that you have shared, after every and each presentation, there are sources there for this particular book on, or for this particular section that you have selected to teach us, or has been added to the content. So for me, the course was very, very helpful. And then looking forward to use that information that is on the content, because I've downloaded everything. So for each and every challenge that I will face within my scope of work, I will always refer. So yeah, that's basically my take on the course.
Thank you very much. I am glad that the course was useful for your profession and what you do on a day-to-day basis in your work environment. And I hope that going forward, you will find the contents of the course even more helpful with your work as you go forward. Like I said, we know people who have received promotion just on the basis of doing this course. There's one in Lesotho working in the hospital. After doing this course, he got promoted. Another one from, is it Mediclinic or one of those private hospital? No, it was a company, not a hospital.
Yes, Medhold. Medhold.
Yeah, okay, yeah. But he did get, he got a promotion. His boss came on to see what we were doing. He did the course, and then one of his employees or subordinates did the course as well, and said, because you've done this course, we're actually going to give you an award and a promotion or something. Yeah, based on this course. Okay. Others have gotten jobs after doing the course, etc., etc. So I hope doors open up for you by doing this course with TUT. Now, one more question, because I just noticed something this morning. The last unit 15 on incubators and radiant warmers, there's a theory part and there's a practical side. Did you see both of it?
When it comes to the incubators, I saw the practical part.
But not the theory?
It's not the theory.
Yeah, I realized this morning that the theory was not open. So I've just opened it this morning.
Yes,
And I will leave it open for you to go through.
Okay, because yeah, I only saw the practical part. Those, I think there are 3 videos. One is from your facilitator, and then the other is from Fluke on the on the that YouTube
One of
video.
them is a 25 to 30-minute video.
Yes,
Okay,
and then yes, yeah, I've seen them.
The second thing, the assessment for yesterday, was it open for you guys?
Yes, it was
open.
Yes.
So you did the assessments and finished.
Yes.
Okay.
Yes.
It appears I noticed, and you use the password to log in.
Yes.
Okay, fine.
Everything has been recorded there. Yes.
Okay, no problem.
Yes.
Now let's talk about the next step. Having completed this course, I want to say if there are any outstanding activities that you have not completed yet,
yes,
you still have the next 1 week to complete and finish, right?
Yes.
Especially the activities for this week. Normally you have a week from the time activities are released to the time they are due for submission. So use the next 1 week to finish up whatever activities or assignments that have not yet been submitted.
Yes.
Okay. So the system will still be open for the next 1 week, after which it will close.
Okay.
If there's anything you need to download, any content you need to download, you have the next 1 week to download it before it closes.
Okay.
So I will go through the rest of the activities and assignments that have not yet been assessed. Within the next 1 week, I'll finish marking it, and then I'll send the results to Ruth and the people in TUTCE so that they can start preparing the statement of results.
Okay.
So the statement of results, I would say, should be available to you within the next, well, say in about 2 weeks' time, because I'll need about 1 week to finish the rest of the marking, collating the marks and all that. And then a week after that, then I would say they will start putting together the statement of results. They will send it to the dean to sign. Once the dean signs, then they can email it to you guys. Our certificate will take about 6 weeks before it's ready, but Ruth will talk more about that. I'll allow her to talk about that. So no, let's talk about it now. Ruth, can you tell him when to expect his certificates after the statement of result has been received, and who they should contact for issues around statement of results and certificates? Okay, I see that Ruth is on hold. I'm not sure if she can still hear us. I'll come back to her later. Maybe she's on another call.
All right.
Okay. Now, when you are downloading the contents for personal use, please note that they are for personal use. They are not to be shared because they are copyrighted material. And TUT owns the copyright. You don't want TUT to come after you for abuse of their copyright.
For sharing the information.
So for your personal use.
Personal use
because
only.
you paid for the course.
Yes.
Right?
Yes.
Okay. So what is the next step after this course? We have a WhatsApp group that usually we encourage participants of this course to join. And that WhatsApp group is for clinical engineering technicians around the country and beyond. And also you will find in that WhatsApp group those who have done this course in the past.
Yes.
In that WhatsApp group, in your day-to-day duties as a clinical engineering technician, if you have any question related to your job, you need any supplier, you need their contact details, you need any spare parts, there's something you encounter in your work you don't understand, just take a picture, post it there, somebody will respond. Whatever question you have, there are engineers across the country that will assist you, right?
Okay.
So
Yes.
it's like a help group for clinical engineering technicians across the country where they assist each other with whatever difficulty they find in the job space.
All right.
So I'll send you the link, and then you're free to join that WhatsApp group so you can collaborate with other police across the country. Then regarding clinic registration as a member of the Clinical Engineering Association of South Africa, you can register with them if you want to. Let me just share screen so that I can show you. If you go to my Twitter, you will see that if you go to the resources section, let me scroll down. If you scroll down, you go to resources.
Yes.
You will see the Clinical Engineering Association of South Africa. So if you click on this link, it takes you to their website. If you want to download the registration form to register as a member or as an associate, the link will take you to the form, and then you can register, and there are lots of benefits when you register. Okay?
Yes, yes.
Okay. So something else, I've talked about the WhatsApp group, and actually there's a link there you can click to join that group.
Okay.
There's also the Global Clinical Engineering Alliance. They do host webinars that are useful, webinars on different topics related to clinical engineering, healthcare technology management, and all those webinars are for free. So you can go to their websites, and then you can see videos of past webinars they've hosted. And then if you subscribe to their newsletter, they will send you information about upcoming webinars and conferences. There's a conference in China later this year in October, but you can attend all of those webinars and gain more knowledge about this field. Now, there's also something like when Tricia Swanepoel in Unit 10 was talking about the patient monitors. She mentioned the training, a Fluke training that you can attend for free online on the Fluke website. So I have put the link here to the website. You can register for that course for free on any of their Fluke testing equipment.
Yes.
You can follow the course at your own pace for free. And once you have completed the course, you can download the certificate. You can add that to part of your qualification that you've done this course for this training equipment, you have the certificate. All of that is for free. Okay? So that also is available.
All right.
Okay. If you want to find out more about where to get some of these testing equipments, Ecomed is one of the suppliers apart from Fluke. Ecomed is a supplier of testing equipment. Assuming your company wants to purchase any of the testing equipment you've seen during this course, you can contact Fluke or you can contact Ecomed. So the link to their website and their catalog, the links are there. Great. So, do you have any question?
That's what else. No, it was just a comment on what you said about the course.
Yes.
So yeah, the course I was referred to by Miss Lisang. Yeah, Miss Lisang Puleng.
Okay.
When I was in Netcare, when I was doing my internship in Netcare. So basically, we did not have any background when it comes to medical equipment. We only did electronics, electrical stuff, and telecommunication. So it was like, I see you guys, you are very passionate about this, and then I like how you have try and be flexible and blend in with the culture of looking out for medical devices. So she was the one who recommended this course to me. But yeah, she had a lot of experience, and that time she was the the clinical engineering manager. Yeah, she was there. So
in what's that hospital now in Centurion? She was in Centurion. Which Netcare was that?
She was first in Centurion, and then she went to Albertine.
Okay, yeah.
Maybe you know her. Maybe you know her.
She was my student many years ago.
Oh, yeah, it makes
over
sense.
15 years ago. Now she's in Cape Town, in Malmed.
You know her, you know her.
Even she, the husband also was my student.
Oh, yeah, that's her, that's her. You
Yeah.
know her. It's a very small world. Yeah. So
Yeah.
she was the one who recommended me to do this course,
Yeah.
saying that, yeah, if maybe you don't have any background when it comes to medical equipments, just do this course and then you're gonna be fine. But yeah, she was the one.
Great. Yeah. Okay, so we are working on another course after this one, and it's
Yes.
a course on healthcare technology management.
Yes.
So we are calling that course Biomedical and Clinical Engineering Technology Management.
Yes.
It's going to be a 12-module course. We are working on it. We are going through the approval process at the moment. But when that course is ready, it will also be offered fully online, just like this one.
Yes. Yes.
So it will be like a follow-up to this course. So when it's ready, we will start advertising it so that those who are interested can also do that course.
That course too,
So
yes.
the combination of this course and that course will make you a powerful clinical engineering technician and healthcare technology specialist.
Yes, yes, yes.
Yeah, it's still in the pipeline, and we're still working on it.
Yeah, I think you should recommend it. You should recommend it so that the companies and staff can start to enroll their technicians or their engineers to be able to be up to times with the new technology. Because what I've seen that each and every content that you have shared, it is up to date with what is happening in the hospital space or in the medical space when it comes to medical equipment maintenance and servicing. Yes.
Great. Okay, Ruth is back with us now. Ruth, can you tell him about the statement of result and certificate? When should they expect and who should they contact?
Sure, I'm not sure. Okay, I think I will ask our managing director, Poto, if she can help in that regard. So, Mr. Tim, please send us the results as soon as possible, and then then we'll take it from there. So, in terms of expecting the certificate, I would safely say 6 weeks. Because the university mostly does prioritize formal qualifications, in a way, but this is a short learning program, so we normally ask them to please prioritize also certificates for short learning programs. Okay. So I'll try to speed it up on my side. I do have a good relationship with the registrar's office, so I will ask them to speed up your certificate.
Who should they contact for issues of certificates and statement of result? Because normally they like to bother me. I said to them, no, I don't do certificates, I don't do statements. Once the course is done, I send the results to you guys, my job is done. So who should they phone and contact and travel when they need their certificates? Can you send him can you post in the chat box a name and email address or contact details of the person they should contact or they should contact for the certificate?
I'm not sure. I think it's gonna be between me, Puto, Mirapelo, our team.
Yeah.
As far as I know, so I think he must follow up with me and Puto directly. Me.
He doesn't have your contacts. Can you put the names and contacts? Otherwise, they'll come back to me and
No, he does have my name and contact.
No, I have your email and and your office number.
Yeah, you can use those ones.
But please, when they phone, answer them, because if you don't answer them, they come back to me.
Yeah, that's true. That's true.
Yeah, and right now,
give him a second option, a second name and email address.
Second option, you mean who else?
Yeah, somebody else to contact, assuming he can't reach you or you are busy at the time, you didn't respond and you want to, contact someone else to get a response. So who should he contact apart from yourself?
I will ask on the group, but I think he must just follow up with me and then I'll send it to the relevant people.
Okay.
So I don't want him calling the whole university or everyone. Just follow up with me and then I'll give you a response.
Okay, so please, when it comes to certificates and statement of result, don't bother me. Once this course is done, I've sent the results to them, my job is done. Not that I won't
Okay.
help to contact them, but normally students like to bother, well, participants like to bother me. When they get frustrated, they come back to me and say, hey, we've been sending emails here and there, we're not getting any response. When is our certificate coming out? I will still attend to you, but at least I want you to know the person to contact on issues around certificates. Okay.
So may I please be
yeah.
excused? I
Yeah,
need to
we are
rush
actually
to
done.
Ditsela.
Yeah, we're actually
I
done.
need to
Thank you
rush
so
to
much, Ruth,
Ditsela. I'm
for being
involved in a
here.
closing of a course.
Okay, thank you, Ruth. Thank you so much.
Okay.
Okay,
It was
bye.
nice meeting you. Yes, please stay in touch with me for whatever you need.
Okay, no problem, Ruth. I will do that.
You're welcome, sir. All right, thank you.
Okay, thank you. So I think we're actually done for now. There's
Yes.
nothing except if you have any questions or comments, but I think from my side, like I said, I will do the marking the next 1 week. I'll finish, and thereafter I'll send the results to Ruth and her team, and they will prepare the statement of results, send it for signature in the dean's office. After that, they'll email that to you, and then they will send it to the registrar's office to produce the certificates.
All right.
Yeah.
All right. No problem.
Any questions or anything you want to ask before we leave?
No questions from my side. I'm well set.
Okay.
Yeah.
Great. So remember, go back to Unit 15 and
Unit 15 and read
content. So it's all
from there.
opened up now. Yes.
Yeah. All right. I will do
Okay
that.
then.
All
Sure.
right.
So it's recorded. I'll post the recording for your colleague also in the WhatsApp group so that you can also hear what we discussed this morning.
All right. No problem. No
Sure.
problem. Thank you very much.
Have a nice day. All
You
the
too,
best.
sir.
Okay.
Thank you. Bye.
Bye. Bye.